According to the American Heart Association, smoking is the most preventable cause of premature death in the United States. Smoking accounts for more than 440,000 of the more than 2.4 million annual deaths. Cigarette smokers have a higher risk of developing several chronic disorders, including fatty buildups in arteries, several types of cancer, as well as chronic obstructive pulmonary disease and other lung problems. The specialists at Florida Hospital Waterman's Heart Center explain how cigarette smoking is a major cause of coronary heart disease, which leads to heart attack.
If you smoke, quit smoking. If you never start smoking, don't start. Obviously, tobacco is bad. First hand, second hand is obviously a bad thing. Obviously, exercise is a good thing you can do. And try to eat healthy. I know we're all gonna eat certain things that are not that healthy, but obviously try not to exaggerate it. Try to eat a lot of fruit, vegetables, have a balanced diet. If there's any family history, be sure you know your cholesterol. Obviously, if there's any family history of diabetes, also that's very important to be established with a primary care physician and check, be sure you are not developing, what we call now metabolic syndrome, which in lay terms is like a pre-diabetic and things like that, and control the blood pressure and try to eat low salt.
The 7 most important risk factors that we look for cardiac disease are family history, age, exercise, diet, blood pressure, smoking history, and diabetes. The earlier diagnosis of cardiac disease is really what I would call a polarizing event in medical care. And they tend to be the not so terribly exciting but very important maintenance things that we're all pretty familiar with: diet, exercise, cholesterol management, stop smoking if you smoke, understanding something that we call what your numbers are. And one of the challenges we have for all of our patients is something I call intellectual honesty. People don't want to know what their blood sugars are. They don't want to know what an ideal body weight is or blood pressure. So I think once we get to that point where we're committed to our own care, male or female, and we understand what all the numbers are, then we can start to understand what the risk factors are.
You'll learn more about the services available and be able to view past Waterman Heart Center stories when you click the Smoking and Heart Disease story link on our homepage, yourhometownhealth.com.